The FODMAP diet is like a superhero that deals with digestive issues, especially a condition called IBS or irritable bowel syndrome. In today's video, I'll give you the 5 major points I recommend as a GI doctor that I want you to do if you're trying to do the FODMAP diet. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert, but board certified gastrologist trained at the Mayo Clinic. Can see us up at Gastro for all your GI needs. So the FODMAP diet is probably the best diet when it comes to IBS, especially diarrhea predominant IBS. Now the problem with a lot of my patients when it comes to the FODMAP diet is that it can be very confusing about what to do, but not only that, a lot of my patients keep on this diet long-term without the help or the benefit of either a GI doctor or a dietitian. So I want to give you the 5 things I recommend all my patients do when they're on the FODMAP diet. Number 1, understanding FODMAPs. So first things first, what the heck are FODMAPs? These are fermentable carbohydrates found in certain foods that are known to produce gas, bloating, and diarrhea. The acronym stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Understanding these components is key to mastering the FODMAP diet. Number 2, high and low FODMAPs. So there are certain foods that are out there that are high in FODMAPs and low in FODMAPs. High FODMAP foods are the ones that trigger gut issues, pain, bloating, diarrhea, upset stomach, indigestion. And what we try to do is we try to find a substitute from a high FODMAP to a low FODMAP so you don't have those symptoms based on what you're eating. We'll explore some examples to make your next grocery store visit a breeze. Number 3, the elimination phase. This is one of the critical phases when it comes to the low FODMAP diet. We need to eliminate all the foods that you're eating that are high in FODMAPs. So there are a lot of lists that are out there. I typically recommend from one called Monash, which they also have an app called the Monash app. So elimination phase is like a reset for your gut. You try to eliminate or get rid of all the foods that you're eating that are high in FODMAPs. Now you may be surprised, a lot of these foods are considered healthy foods. So it's not a matter of eating healthy versus not healthy. It's making sure you're eating the right healthy foods for your body. These include foods like broccoli, apples, pineapples, pears. These are foods that are normally healthy for you, but maybe in your body, you're not able to metabolize them appropriately. The goal is to eliminate all these bad foods to see if you feel better and you get your GI symptoms back on control. Number 4 is the reintroduction and challenge. Once you've eliminated all the high FODMAPs and identified your particular triggers, your job next is to reintroduce those foods to see if they're your particular trigger. This is where you systematically, under the help of a dietitian, reintroduce those foods that are high FODMAPs to see if that particular food is your particular trigger. So what I mean by this is every single person is different. We all have a different microbiome. We all have a different way of metabolizing things. And sometimes what is one person's trigger for a high FODMAP may not be for you. This video is sponsored by Lubbock Gastroenterology Hemorrhoid Banding Clinic. We take care of hemorrhoids, and I know this is something people don't want to talk about. But if you're suffering from hemorrhoids, whether it's pain, bleeding, itching, or pressure, you don't have to suffer on your own. I know it's a pain in the butt, but we can fix that. We can get this taken care of for you. We do what's called hemorrhoid banding, which is a quick, easy, painless procedure that only takes about 10 seconds. But no one believes me. This is the most effective way to take care of hemorrhoids without the need for surgery. So if you want to learn more information about hemorrhoid banding, don't forget to call this number where we can get you scheduled the same day to get your hemorrhoids taken care of. Tip number 5, collaborate with a dietitian when you're going on your low FODMAP journey. I cannot stress how important this is because a lot of my patients go on the low FODMAP diet on their own. And what they do is they eliminate everything, but they don't reintroduce things systematically. And so they end up having such a restricted diet that they can't live the life that they want to live. It is very important for you to have the help of a dietitian to know exactly how to eliminate the foods, how to reintroduce those foods, and to find out what triggers are your particular foods. It is critical for success. All the studies on the low FODMAP diet always recommend and mandate you need the help of a dietitian to understand what your food triggers are for you individually. Now keep in mind that the FODMAP diet may not work for you, and that's okay. When you look at the evidence for the FODMAP diet, only 50% of the patients who have IBS actually respond. But it is a great effective option if you're looking for a natural way to help out with your IBS, especially diarrhea, bloating, and abdominal pain. So here's my call to action to you. Are you ready to embark on a FODMAP diet? Fantastic. Remember, it's always important to consult a dietitian, talk to your GI doctor about what you can do, talk to a doctor to see if this is the right diet for you, and always make sure, once again, you make changes with the help of somebody who knows what they're doing. So here's my question of the day. Before you go, I want to know, have you tried the FODMAP diet? Has it worked? What has been your experience with this diet? Comment down below. I would love to hear what you guys have to say. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.